Hello and welcome to Local Doctors on Call. I'm Alex Redmond. Are you unhappy with your rear end? If your bottom is giving in to gravity, we may have a solution. You have maybe heard about the Brazilian buttock lift or the Brazilian butt lift, but how is it done? How much will it improve your derriere? And is it the right procedure for you? We will also talk about fat grafting and how it can enhance other parts of your body and show you the Vectra 3D, which is an exciting new technology that is currently exclusive to Sarasota Plastic Surgery Center in our area. Dr. Scott Engel of Sarasota Plastic Surgery Center is back. He will take your calls and answer your plastic surgery questions. He is also board certified by the American Board of Plastic Surgery. He is a fellow of the American College of Surgeons, and he completed an additional fellowship in aesthetic surgery at the Cleveland Clinic in Cleveland, Ohio. Now, you've just returned from vacation, but it wasn't just a vacation. It was a working vacation. You did some educational training there?
It was. We had our national meeting for the the American Society of Aesthetic Plastic Surgeons in Vancouver, and it's a national meeting for cosmetic plastic surgeons. And it was a really informative meeting.
So what were the things, what was the topic?
Talking about just new general trends in plastic surgery, such as fat grafting and different types of breast augmentation and different techniques in all aspects of cosmetic surgery. So it's the really world-renowned experts from around the country and around the world.
So tonight we're going to open it up. We're not just going to talk about the Brazilian buttock lift. We're going to talk about breast augmentation, fat grafting. You can actually enhance your breasts through fat grafting. So if you don't want to go in for the implants or you just want a little tweak here and there, you can do that. And if you have questions that you would like to ask Dr. Scott Engel, we're opening up the phone lines right now. So you may go ahead and call us at 361-4675. 361-4675. Don't be shy. Pick up the phone because he's sitting right here, and that way you don't have to go into the office for your first consultation. You meet him right now. All right, let's talk a little bit about fat grafting and exactly what it is.
Sure. Fat grafting is basically taking fat from one area of the body and transferring it to another area to volumize it. And essentially, it's also called fat transferring, basically transferring the fat from one area to the other. One area that may have a little too much fat, another area that needs some more fat.
Now, who gets it? Is it young people and older people? Or?
There's two reasons to have fat grafting. One is aging. The old way of thinking that aging was that we would just lose laxity in our skin and that we would our skin would get loose and wrinkly. But what we realized is aging is actually a loss of volume. And so I kind of say when we're younger, we're more like a grape. We're full and we have a lot of volume. And as we age, we lose volume, specifically in our face. And so we turn from a grape to a raisin and we lose that volume. Well, so to rejuvenate the face, we're not just pulling back skin and tightening with a facelift, we're volumizing it with things like fillers such as Restylane and Juvederm, like you've talked about before. Well, what a better way to do it than using your own body tissue and using your own body fat, so to volumize it with that. Those are for people who want to look rejuvenated, so go from an older appearance to a younger appearance. Now, there are young people who just kind of want to get what, unfortunately, God didn't give them a little more enhancement, and so volumizing their buttocks or their breasts by fat grafting.
All right, if you'd like to call in with your plastic surgery questions, 361-4675. That's 361-4675. And right now we're talking about fat grafting, how that can enhance different parts of your body. So go ahead and call us. Now, when you take the fat, is it fat from another person? Is it fat from a cadaver? Is it from you? Is that where you harvest it from?
We get a lot of volunteers saying, I'll volunteer my fat. Unfortunately, we can't transfer it from one person to another. It's a good question. It's taking fat from your own body and transferring it to another area in your body. And so it's your own substance. You can't fight it or break it down. In many cases, there's an abundant amount, hopefully.
All right, now let's talk a little bit about the different parts of the body that you might want to enhance. Sure. If you were going to say enhance the hands, because one of the telltale signs of a woman that's actually getting older are her hands. Because you can have a young-looking face and a young-looking body, but if you really want to tell a woman's age, look at the hands. What can you do for hands?
Exactly. Well, it's the same thing. Loss of volume in the face as we age and loss of volume in the hands as we age. And especially being in Florida, also sunspots on the hands. And so one of the best things that we can do here is volumize the hand by transferring fat into the hands and also lasering the hand to take off those brown spots to kind of rejuvenate the hands. Exactly. The telltale signs of aging is the hands. And so taking fat from one area and putting it in the hands is a great way to kind of give back that volume that you lose as you age.
All right, our phone number is 361-4675. 361-4675. We are live tonight, and Dr. Scott Engel of Sarasota Plastic Surgery Center is here talking about plastic surgery. And right now we're talking about fat grafting. So we talked about the hands. Let's talk a little bit about how it can enhance your face.
Sure.
Yeah, I guess when you get a little older, you want your cheeks to look plump or at least full the way they did when you were younger, not sallow and sunken in.
Well, that's exactly right. And so a lot of times I ask people to bring in pictures of themselves when they were younger, because all we want to do is kind of restore that volume that you had when you were younger. And so we have a lot of fillers that are available, but they cost money and they're only temporary. The good news about fat is the fat that makes the trip, some of the fat doesn't make the trip from the belly to the face, but the fat that does live is there permanently, and it's your own body. And so the common areas that will do that is the nasolabial folds, or the creases along your nose, in the marionette lines or the puppet lines in the corner of the mouth, and giving that back that volume in the cheeks. As you lose that volume, people start to look sick or cachectic and ill. So in order to kind of reverse that, filling it up with fat is a great way to do it.
Now, is there a chance, as great a chance of the body rejecting it as maybe something like Sculptra? Does it seem to work better with your own body by using your own fat?
It works much better because it's not really a rejection process. It's just that some of the fat that we transfer doesn't live. It just doesn't make that trip. But the fat that gets restored by your body and incorporated is there forever. Whereas these other substances, you're right, your body will break it down, and it's only a temporary effect. The other great thing about fat grafting is that we're noticing that there's stem cells in it, and so it helps to rejuvenate the skin. And fat grafting has been around for a long time, but we're doing a lot more studies now to determine, well, what's going on with these stem cells.
All right, go ahead and call us at 361-4675. 361-4675 with your plastic surgery questions. Don't be shy, pick up the phone. All right, let's talk a little bit about the Brazilian buttock lift, or the Brazilian butt lift, because we've all seen J-Lo's booty, and she has a very cute one. Some people were not born with a butt.
Right.
Let's face it, some people are very slender, and they basically are straight up and down. And as we age, we get what I call it's the ham butt, which is when your hamstring and your buttocks becomes one thing and there's no line of demarcation. Sure. So what can you do about that?
Well, exactly the same thing. Like everything else, gravity takes effects. Like it takes effect on the breast, it takes effect on the buttocks. And so same thing, as we age, the buttock loses its volume, it loses its elasticity, and so it can droop. Now, the actual term Brazilian butt lift is kind of a misnomer. We're not actually physically lifting it with an incision. We're just volumizing it. And so, like you said, the nice shape of a buttock, like a J-Lo buttock, or what they call a Pippa butt, the Pippa Middleton butt, buttocks is a round, shapely butt. And some people say, well, geez, I wouldn't never want a large butt. Well, it's not really that. It's more shaping it and kind of giving it that, in a sense, a lift. Well, what's the best way to do that? There's two ways. An implant, which can be a very painful procedure, and it's a foreign body, or transferring fat from one area from your body to another, and it's a great thing to do, to inject fat into your buttocks.
Now, why do you choose to use the fat as opposed to putting the foreign implant in?
I don't like the procedure. Chances of infection, of extrusion. You know, you're sitting on this implant all the time. It's not like a breast implant where you're not constantly, you're constantly sitting on this implant. It can cause some pain and discomfort, chance of infection and extrusion. So again, using your own body substance, your own body fat, well, what's the best way to do it is to just transfer it to that area, and it's a great way to volumize it and lift it.
Now, who gets the Brazilian butt lift?
Same thing. People of all ages, people who are not born with a buttock, who just have a flat buttock, people who have a massive weight loss, who've lost a lot of weight, and again, same thing, it'll drop, and patients who have aged. So really anybody from their young adulthood to people in their 50s and 60s.
All right, if you'd like to call in with questions, our number is 361-4675. That's 361-4675 with your questions about plastic surgery, breast augmentation, Brazilian butt lift, or whatever you want to talk about related to plastic surgery. And we will take those calls when we come back from the break. 361-4675. We'll be right back. Stay with us. Welcome back to Local Doctors on Call. I'm Alex Redmond, and tonight we are being joined by Dr. Scott Engel of Sarasota Plastic Surgery Center. He's answering your plastic surgery questions, and we've been talking about fat grafting, the different parts of the body that you can have that done to enhance your hands, your breasts, your face, and of course the Brazilian buttock lift, which isn't really a cut and lift thing. It's more just, plumping it up and, giving you a shape there. All right, if you'd like to call in with your questions, 361-4675. That's 361-4675. Let's talk about the Vectra 3D, which is a new piece of equipment. We have some photographs that we're going to bring up. And this piece of equipment you purchased recently, making it exclusive to Sarasota Plastic Surgery Center.
Exactly. We're really excited about this new technology that we have at Sarasota Plastic Surgery. It's basically, it's an imaging system with 6 cameras called the Vectra. And it basically, here's a picture of it. It takes a picture of a woman's body, and you can take a picture of the breasts or the face or the buttocks. And using 3D, we can actually rotate the pictures and make changes to the patient's body through the computer to show you a simulated version of what you'd look like. And so it's a really...
And now we have the picture right here of the breasts,
right,
where it shows you the outline.
Exactly. And so, a lot of times patients really want to know what they look like, and we never really had good technology to show giving patients an idea of what they would look like. And now with this new system, really gives us a way to show patients what they would look like, and not only just from the front view, but from all dimensions in that three-dimensional.
And we even have another photograph which shows somebody in full dress, which is showing that they're quite small busted here and how you've been able to enhance them there.
Exactly. Patients, they'll look at pictures and show you what kind of breast they want to look like, but this is pictures of themselves enhanced. And so it's not only that, but showing pictures of pre and post-op pictures of themselves, we can also get a good three-dimensional view of what they look like. And we're thrilled to have it. It's a new piece of equipment. We're the only ones in the area to have it, and we're really excited to implement it.
Now, when I was researching the website, I saw that there were pictures up there of somebody that had rhinoplasty or a nose job.
Exactly.
And so tell us the different parts of the body that the Vectra 3D can show, how you look now and how it can show you after you've had your procedure.
Exactly. Well, we always had an imaging system where you can morph the face to show what a rhinoplasty or nose job would look like. But now, again, in 3D, now we're able to make changes in the computer to give you an idea of what you'd look like. And so rhinoplasty or nose job, fat grafting, give you some volume in the face or volume in the buttocks, and to give you an idea. Now, they're only simulated versions, so we can't guarantee that they're going to look exactly like it, but it gives you the best opportunity to see what you'd look like, and it's really a phenomenal advancement in technology.
Sure. Well, obviously, if someone came in, like we saw in the picture on the website, if they come in and they have a rather prominent nose with a large lump on it, and this girl, it showed how it would look after it was done, and it was straightened out, and it looked beautiful, and the same thing with the breasts.
Exactly, exactly.
All right, so if you have questions you'd like to ask Dr. Scott Engel, it's a great time to call right now. Our number is 361-4675. 361-4675 with your questions about plastic surgery. Pick up the phone. We'd love to hear from you. So we talked a little bit about the Vectra. Now let's get back to the fat grafting. What are the risks involved with that? Is it a high-risk procedure?
It's not. It's not a high-risk procedure. The biggest complication or the biggest problem that we normally have is how much of that fat we can have survive. And so, like anything else, it's better to undercorrect than overcorrect. It's much easier to have to do it in a few stages than to overdo it and make it look overdone. Any kind of plastic surgery that's overdone is not natural. And so the biggest thing is probably undercorrection and some of that fat not living.
Now, if you don't have enough fat during the procedure, the first time that you go in for it, are you able to go back in and add more?
Absolutely, absolutely. absolutely. You know, sometimes people don't have enough fat, and we have to do a little. It's a challenge to be able to get some fat to put in there. Now, some people may not be candidates for fat grafting if they don't have a lot of fat, or we may ask them to gain some weight to try to get some of that fat to harvest. And so, yeah, absolutely.
Say somebody came in and they wanted to have a procedure to enhance their breasts through fat grafting. How long does that procedure take?
That usually takes it usually takes a while, and it usually takes several stages. Now, that's still in its infancy, and we have centers across the country that are studying breast augmentation, primary breast augmentation with fat grafting to make sure that it's a safe procedure. Now, while we know it's safe, we want to make sure that radiologists can read mammograms and make sure that they know what is true fat versus breast tissue. I do fat grafting all the time for breast reconstruction and contour deformities. It's just a matter of making sure that we get it cleared from our society, that it's a safe procedure, and that the research is done.
So the risks are pretty low, and the risk of rejection is Zippo, right? It's 0. That's great. If you have a question you'd like to ask Dr. Scott Engel of Sarasota Plastic Surgery Center, pick up the phone, call 361-4675. We are live tonight, 361-4675. We have a phone call. We have Jim on the line. Hi, Jim. Thanks for calling the show. What would you like to ask Dr. Engel?
Hey, Dr. Engel. Thanks for taking the call. I'm 56. I do a lot of work outside, so, you know, a lot of sun exposure, wrinkly, not, you know, super leathery face, but getting there. And what I need, without seeing me, I know it's tough, but would I need a full facelift or mini facelift, and what's the difference? Because I see a lot of this like mini lift.
Sure. Sure. Basically, the amount of incision is what differentiates a mini facelift from a facelift. And so you're right, it does depend on what you look like in coming in for an examination, which would be happy to see you at Sarasota Plastic Surgery. But basically, especially in men, I want to make sure that I give you a natural result, not making you look overdone. And so depending on the degree of laxity, it can be done a mini incision, which is a mini facelift. If you've got a lot of laxity and a lot of aging, then you need a standard facelift, which is basically just more of an incision, one that extends more up into the hairline and up behind the ear versus just a small incision around the ear. And so it kind of just depends on how much laxity you have, and we can determine that through an examination.
All right, thank you for your phone call, and the phone lines are open now. If you'd like to call in with a question for Dr. Engel of Sarasota Plastic Surgery Center, 361-4675. 361-4675. Take the opportunity. Call us. We want to hear from you. More men getting plastic surgery nowadays?
Absolutely, absolutely. You know, years ago, everybody thought plastic surgery was for the wealthy women, and it's not the case anymore. Now it's men and women. You know, it's the housewife, it's the middle class mother and the middle class man having surgery, and so it's everyone's having plastic surgery. You just may not know it.
All right, the number to speak directly to Dr. Scott Engel is 361-4675. 361-4675. Andrea's on the line. Hi, Andrea. Welcome to Local Doctors on Call. Go ahead with your question. Thanks for calling.
Hi, thank you. This is something that I've really been intrigued about. I only weigh about 110 pounds, so I don't have any fat to be sucked from someplace else. How would you enhance my father has a very flat derriere. My mother has my whole family. Where would you take it from to enhance me?
Sure. Yeah, you know, in some people it is a problem finding enough fat. I know it's a bad problem to have, right? But there are certain locations that have better fat takes. So the lower belly, the inside of the thighs, the bottom of the buttocks, or the outside of the thighs are generally the biggest areas that I get my fat from. If you don't have a lot of fat, you may not be a candidate for fat grafting and may need something like a buttock implant. That may be your only option, but usually we can find some areas enough to give you that shape that you want. It kind of just depends on the examination.
All right, and if you wanted to go in and see Dr. Engel over at Sarasota Plastic Surgery Center, you may go ahead and pick up the phone, and you may call him at 366-8897. That number is 366-8897. And also, Andrea, you may go online to sarasotaplasticsurgery.com. And the phone lines are once again open. Go ahead and call us at 361-4675 with your plastic surgery questions. Again, that's 361-4675. Can you change the shape of the body by moving the fat around? Can you actually mold it into place? How does it work?
In a sense, you can. Now, some of it has to do with the underlying bone structure. So there's a changing that you can do to give it a more pleasing or aesthetic shape, but it has to be done first of all by someone who's qualified and knows how to do it. Taking area from one fat and putting it to another, for instance, in order to give yourself a nice buttock shape, taking fat from the love handles to give a little more of an hourglass appearance is a great thing to do, and then transferring it to give you more of a prominent buttocks in the center of the buttocks as opposed to the top. There's two different types. There's several different types of buttocks. We call it the A frame or the V frame or the square buttocks. And so you have to take a look at several different shapes of buttocks and the kind you have, and see if we can transfer or transform that type or that shape of your buttocks to a different shape.
Well, I'm sure that we know some people out there that would love to take those handles, those love handles, and put them somewhere else on their body. So if you'd like to talk to Dr. Scott Engel about that, our number is 361-4675, 361-4675, and we will take your calls when we come back from the break. So please stay with us. We'll be right back. Thank you. We're back. You're watching Local Doctors on Call, and Dr. Scott Engel of Sarasota Plastic Surgery Center is here talking about how you can enhance your body through fat grafting and your face. And we're also talking about the Brazilian buttock lift. But I think we should address the safety issue, because there are a lot of people out there. We see a lot of signs, come in from your lunchtime booty lift and come in for your breast lift done in half an hour, and get it done half price and things like that. What should people look out for, and what should they know about the safety aspects?
Well, sure. These are safe procedures as long as they're done by a qualified surgeon, by someone who's board certified in plastic surgery. At Sarasota Plastic Surgery Center, we're all board certified plastic surgeons. It's Dr. Braun Graham, Dr. James Schmidt, Dr. David Mobley, and myself. And making sure that I don't know if we have our symbol to show, but the American Board of Plastic Surgery or the American Society of Plastic Surgeons show that your surgeon has been qualified. You gotta be careful. There's a lot of people out there who are not qualified to do plastic surgery, and they call themselves plastic surgeons. Well, you need to make sure that you see that symbol, or you make sure your doctor is board certified by the American Board of Plastic Surgery.
Is there a way to check those credentials out online?
Sure, you can look up the website for the American Board of Medical Specialties or the American Society of Plastic Surgeons, and those are American Board of Plastic Surgeons who are qualified to do those procedures, and so that's your best way to do it.
All right. Now, we were talking a little bit about how fat grafting can help to enhance certain parts of your body, but also how it can make your skin look younger. What about stem cells? How does that play into plumping up the skin?
Sure. There are stem cells that are in the transferred fat, and there's a lot of research that we're doing right now to determine what the effects of stem cells are. But as we read about it and we hear, stem cells can transform into any kind of different type of cell that wherever you put it. And so what we're realizing is it really has these beneficial effects to the texture of the skin, to the color of the skin, and really a rejuvenating effect. Now, we're still doing research to determine exactly what it is that creates that and how to enhance that, but really we do see those nice results.
And do you see people coming in who had in the past maybe opted to get Sculptra, or who were thinking about getting Sculptra to use as a filler in their face, now opting for fat grafting?
Absolutely. I know a lot of people who are hesitant to do some fat grafting. They don't know how they're going to look. A great way to do it is to use a temporary filler like a Juvederm or Restylane or Sculptra to see how they look. And once they see that result, once it goes away, then use something like a permanent, like fat.
All right, if you'd like to call in with your questions for Dr. Scott Engel of Sarasota Plastic Surgery Center, the number's 361-4675, 361-4675. And Judy's on the line. Hi, Judy, thanks for calling the show. Go ahead with your question.
Thanks for my call, Dr. Engel. 2 years ago, I had Mohs surgery done on my thigh, and it was quite the event. And the scar is about 4 inches long. And he took a lot of muscle out of there, so I have a dent in my thigh. Is there some way to correct that?
Absolutely. You bring up a good point. of course, our topic today is fat grafting, and so it seems like my answer for everything is going to be fat grafting, but it really is. The best way to fill in a contour deformity like that is using some sort of substance. Well, what's the best substance but your own body fat? I do a lot of fat grafting to deformities or concavities from things like excisions, from steroid injections, people who have had liposuction by people who are not adequately trained. Unfortunately, I've had to do some fat grafting to areas that are deformed by inexperienced people doing liposuction. So yeah, absolutely, fat grafting, it would be a great way to kind of fill in those little bumps or dents from other procedures.
Hey, Judy, thanks for the great question, and actually something I'd like to share with Dr. Engel and with our audience. I had a Mohs procedure done, which is for a skin cancer, when I was very young. I was in my 20s, and I had that from sun damage, and it was a basal cell carcinoma, which is the mildest form that you can get. If you're going to get cancer, that's probably the one you want to get. But they still dug quite a deep hole, and way back then, I had plastic surgery to sew it up because on my face, I didn't want it looked like someone had stuck a thumb in my face. So I had that done, and I was very happy with that. And we've come a long way since then. So it's good to know that something as minimally invasive as fat grafting can now replace having to go in there and pull the skin and just sew it up. I mean, that's wonderful. You fill in the gap with the fat grafting.
Fill in a contour deformity, yeah. Not necessarily filling in a skin defect, but filling in a contour deformity from something like that. I've seen a lot of patients who have had certain procedures like injecting steroids, and those steroids sometimes can cause atrophy to the soft tissue, and in order to fill in that hole, or kind of fill in the divot with some sort of material, well, fat's the best way to do it.
Right, and if you want to get a hold of Dr. Scott Engel, you may go online to SarasotaPlasticSurgeryCenter.com. That's SarasotaPlasticSurgeryCenter.com, or you may call 366-8897. Maybe you're curious about how you may look after you have a procedure, and you want to see how you look now, and then the Vector 3D, which you now have, only place in our area to have it. It's exclusive. We'll be able to show them. All right, Dr. Engel, thanks again for being on the show. Thanks for taking time out of your very busy day to spend it with us on Local Doctors on Call. Like us on Facebook, Local Doctors on Call, and remember, it's your health.